I'm Dr. Taofeekat. I work at the Institute of Human Virology, Nigeria. I coordinate the public-private sector grant for TB, funded through the Global Fund. My earliest memories of TB was losing a young cousin. As a clinician, I watched patients lose the battle against TB. And I particularly remember as a young medical officer, it was painful to see another child die of TB. And now, a public health specialist, I see the devastating effects of TB on human and capital resources. Patients lose their means of livelihood, families become impoverished, and the health system is further overstretched with the burden of care for TB patients. Indeed, TB affects individuals, it affects communities and businesses. And I can clearly appreciate how far we have come, but importantly, how much more we need to do to end the scourge of TB. The need to bring more resources to the table cannot be overemphasized. Here and now, I add my voice to the clarion call for everyone to get involved. Global Fund has been the largest international donor for TB in Nigeria. We need all hands on deck. Get involved, mobilize resources, end TB, save the future.